Dr. Randy Richardson takes care of many children with muscular dystrophy at Seattle Children's Hospital and uses state-of-the-art approaches to help these young patients. Hunter Rader, a 10-year-old boy with muscular dystrophy, is here to discuss how he's doing with Dr. Richardson.
With the weakness that we see in Duchenne, we also see tightness of various joints, including the heel cords. And it sounds like that's one of the things that you've appreciated in Hunter's case.
Yes.
Okay. Is that becoming difficult to manage?
I would say yes.
Yes. Okay.
Yes.
Tami, if you heard about a family whose son was recently diagnosed with Duchenne muscular dystrophy, what would you tell them? What would you tell them to help them guide them through this process?
First, I would ask if they were in touch with the MDA and to get in touch with the Muscular Dystrophy Association. And they are very good advocates to help you with any questions. They help you in the schools. And I would ask the parents if they're going to any groups to help them along, just to see how they're doing with the diagnosis. It's a hard diagnosis, and especially when you have two. But just make sure that they understand the diagnosis. I'm still learning as we go along. I have a videotape at home that explains everything to you. And I got it when Quincy was diagnosed.
And it is a stepwise process. I mean, there are a lot of people here that are, able to figure out and solve problems as they arise. You're really the ideal family from that perspective, because you come in, you say, here's our new problem, what do we do about it, and we figure it out together.
Yeah, I don't want to know any other problems until they happen.
All right, Hunter, I'm just going to listen to your heart, belly, and then we're going to look at your strength.
I know.
All right. Okay. Now, let's look at those joints. Just going to see how stretchy you are. Okay. Maybe just a little bit of tightness in the fingers?
Yes.
Yeah. That was not that bad. Now let's look at your legs. Calves just feel a little bit tighter, and that's something we expect.
Yes.
Okay. All right. I want to look at your strength. Can you hold your arms up in the air? Keep them up. Don't really push them down, and push down as hard as I can. Good. Very good. Can you make the biceps? Get up. Good. Just a little weak. That's better on the right than the left. Can you spread your fingers for me? Spread your fingers really wide. Good. Good hand strength. Can you squeeze my fingers as hard as you can, try to break them. And I can't break those at all. So weaker in the shoulders and weaker than in the hands itself, which is what we expect. Tam, what would your advice be to a parent of a child who has Duchenne muscular dystrophy?
Take it day by day. Don't rush it. It's going to happen. You don't want to say, oh, my child's gonna, be worse the next day when he could be better the next day. Just don't rush it. It's gonna happen. Just don't put him. I don't know how to say that without it being rude. Everyone knows the outcome of Duchenne. Just don't bring that outcome the next day. Quincy, our oldest, he's doing very well. He has heart issues, so we take it day by day. Oh, stop it, Hunter, please, baby, stop. So that was what I would tell them.
Okay.
Yeah. So it's a heartache, but there's good days and bad days. Just make sure you have someone to talk to on your bad days.
I say the same thing. Don't focus on the diagnosis every day.
Exactly. I didn't know how to. What I was going to say wasn't going to be really nice.
No, that's perfect.
Stop.
But don't focus on the diagnosis every day, and realize that there's so much more than a diagnosis. And this is just one thing.
They're still children.
Yeah.
You got to treat them as children.
Yeah.